Right now on 12 on Health, techniques to get teens with autism to communicate, plus a promising report on breast cancer treatment, and where cancer patients can buy products designed especially for them. This is 12 on Health with Gillian Neff.
Hello everyone, welcome to this edition of 12 on Health. You're watching News 12 Connecticut, as local news gets. Now, spring is finally here, not a moment too soon after all we have been through weather-wise. It seems everyone is getting outside and walking and running and you name it, but not so fast if you have back issues, joint pain, or other recurring problems. Doctors say you want to attack that workout strategically. You can still work out, they say. You just want to avoid injury. And here with advice to keep you up and running is Dr. Kevin Plancher of Greenwich and in New York City-based Plancher Orthopedics and Sports Medicine. Dr. Plancher also founded the Orthopedic Foundation for Active Lifestyles in Greenwich. That's OFALS. Thanks for being here.
Thanks for inviting us.
So many people I know have knee pain, and you're telling me they should still be exercising.
We absolutely want people to get out. The spring is here, and to make sure they're staying in shape to get ready for the sports they love to do.
Oh, you want them to keep at it.
I absolutely want them to keep at it. And they know what they want to do. We just have to do it safely.
Okay. What is the typical issue with joint pain?
Unfortunately, the body is made that the patella tendon is rather small. And so when we're working out in the winter months in the gym and we're doing our leg extension exercises, we really can irritate it rather badly. And so a lot of patients come in and they want to go out jogging now and they suddenly get kneecap pain.
Oh, so it's not necessarily the joint wearing out.
It's not. In fact, it's the muscles around the joints, so that if they're strong, then the joint itself doesn't do much. And so if the joint doesn't do much, then we really can have very few problems with inside. And so we don't get any arthritis then.
So that sounds to me like the best problem.
That is the best problem.
Because that's the one you can really work on.
You absolutely can do some great exercises, even in your home, as you're getting ready by stretching. You need to make sure that you warm up to get the blood supply into the muscles so the joint does a little amount of work.
Okay.
You need to get the best shoes. You should throw away those running shoes that you had from last season.
Stop being frugal.
You need to get the cross trainer because you may be playing tennis. You may just be playing with your children outside some soccer. You may be throwing the ball.
So you know, so many of us look at the bottom of the sneaker and say, oh, it's still got tread, but it's more about the inside?
It's both the inside, and now you can get some kind of inside support, because as we get to be a boomeritis, if we are from 40 to 60 in the middle age, our instep really falls down, and so we get flat feet even though we don't have flat feet per se.
Okay.
So it's both inside and outside you really want to look for.
If you're working out, even if you're going up and down stairs and you're feeling it, is that a reason to stop doing that?
As long as you can get rid of your discomfort after a few days. It's just when you're first working on a stair stepper, for instance, and you do too much repetitions, you really want to do things with high reps and low weights. So you don't want the settings too high. It doesn't make any sense to exercise for 5 minutes on a high endurance. Rather, how about 20 minutes doing it on a low tension?
So if you're feeling it, listen to your body, just make adjustments.
You should absolutely do that.
Now, if somebody has the kind of joint pain that is coming from arthritis, what is the issue in the bones?
Well, if it's from arthritis, they're going to have a chronic ache, whether they wake up in the morning with a chronic ache or they go to sleep with it. That's different than when you're working out now suddenly getting muscle ache and deep pain.
So if you have arthritis and you pretty much know it, should you work out anyway? Should you work through that pain?
You absolutely should find that exercise, because there's so many different things, whether it's a Pilates class that you can do rather than an impact class. So you can find the right instrument or tool to make your knee work for you so that you can stay in shape, get your heart going, and get your general health better.
Biking better than, say, walking?
Biking is great, but walking, a lot of people just want to walk. You can walk at a faster pace. You can walk at a slower pace. The weather's there for you to do it outside.
If you have the kind of arthritis that you feel kind of gets worse each year, a little bit worse each year, are you doing any further damage if you do maybe a power walk?
Yeah, you're not probably doing any damage in a power walk, but if you're starting to get each year things are getting worse, you may want to consult an orthopedic surgeon or some type of sports medicine doctor to find out, because there's so many things to do that do not involve surgical intervention that can make you feel better.
Okay, we're running out of time, but I want you to just quickly address shoulder issues because so many people have them.
So if you're in the gym and you're doing lifts and you're above the arms, you want to make sure that your head of your humerus or the ball does not hit or bang into the roof. And so that's pain, and you can do that by doing high reps, low weights, substitute an incline press for a military press, and have a lot of fun in the gym.
Okay, don't try to be so impressive with all that weight. It's the repetitions?
It's the high reps on the high weights.
Thank you so much, Dr. Kevin Plancher. In just a moment, we'll take you inside a place where people with autism thrive. What can be done to calm young people with autism and then spark their language? We're going in depth in just a moment on 12 on Health.